The Ghana Medical Association wants a review of Ghana's approach to fighting the coronavirus pandemic. This follows the emergence of a new strain of the virus in some parts of the world and what the GMA believes has been the less than satisfactory approach of the authorities, even as the cases in Ghana begin to surge. The number of active cases in Ghana has shot up to 1,261. with the related deaths at 338. Even though many analysts are of the view the stats from the Ghana Health Service does not represent the true picture, as not enough tests are being conducted. Joynews' Raymond Akwa, who had a near-death experience with COVID-19, for instance, has been recounting how none of the people in his circle were contact traced.
Since I got the results and moved to the hospital, and there were days in between getting the results and moving to the hospital, nobody has asked whether or not I've been to Joy FM, whether or not I've been to church, whether or not I have been to any other place and the people I've had contact with. In fact, I am convinced that nobody in the system knows who I live in my house with, how many people are here, and who I'm in constant touch with. I'm not indicting anybody. My own wife, who has been with me throughout all of this, there isn't a single time I recall she's been asked, where have you been going? You've been with this gentleman through this, right from the beginning. In fact, she rushed me to the hospital the day I had the crisis. And that particular day, throughout to today, there's not been any contact with her on these matters. Just to even ask whether she has taken the test, when she took the test, what was the result of the test? None of those has been engaged. And I am in constant touch with her. She basically spends half of the day waiting for me, even at the hospital sometimes, bring me food and all of the other processes that she has to go through. I am convinced that if it is me alone and I cannot extend to other people, this process has not been followed.
Director of Public Health at the Ghana Health Service, Dr. Franklin Sedubekwe, admits there's been a challenge with managing positive cases detected by private labs.
When we brought in the other players, whereby it's more private-led, there's a challenge about linkage of the cases to care. So in that case, it's now being seen as just like a case of malaria. You are diagnosed and that's the end. So that's why we are trying to now further engage the other labs, that you need to link a confirmed case to a health system. But that is how the contact tracing goes on. So that's one challenge we are trying to address. And this week we are going to have a meeting with all the private labs. We apparently went ahead to kind of situate our surveillance officers in some of these labs, but the labs keeps on expanding. So that purpose of identifying contacts and contact tracing is somehow missing because of this new working.
Ghana Health Service, when this challenge first came up, indicated they're going to meet with the private lab, labs, because you realized that was a challenge. 1 month down the line, we're still talking about meeting with them.
No. I think that maybe you have to listen to what I said. Now, almost every other week, we have a new private lab being opened. So as they open, then they need to have more engagement. And clearly, as I said, so if you look at places like Yahoo and MDS Lancet and the rest, we actually engage them on a regular basis, focusing on the linkage to care.
So Raymond, for instance, tested at Noguchi. Noguchi had been doing the test all this while. Are we saying that linking hasn't been done all because Noguchi has been testing, and here's a case where nobody in his household has been contact traced ever since he, contracted COVID-19?
So let me get clear here. The working component of the testing, the fact that it has its own positive effects, as I said, has brought a lot of challenges that we are trying to address. Because normally, Raymond would not have just walked into a facility and done a test without being linked to the care. And I think that is a big challenge for us as a system. And that's why we said, so we actually put surveillance officers, just 2 days ago, we had a meeting and we are saying that we need to make sure that the lab themselves take this other responsibility, because it's not just a testing. And I think that's a challenge we are trying to unravel.